73 have joined. अच्छा जी, हिप बोन के बारे में अभी आपने क्या खुद पढ़ा, क्या चीज़ समझ आई, टाइप ऑफ बोन क्या है, कितनी बोन से मिलके बनती है, क्या सब कंपोनेंट्स हैं? आप में से खुद को आंसर कर दे या मैं फिर बाय नेम बताना शुरू कर दूं, फिर आप लोगों के लिए प्रॉब्लम होगी। अच्छा जी, हमादुर रहमान।
इट्स एन इनोमिनेट बोन और 3 बोन से मिलकर बनती है, इलियम, प्यूबिस।
स्थान रेगुलर बोन है, इरेगुलर बोन है, किस तरह की बोन है?
इरेगुलर।
अच्छा, एक जो थोड़ी सी कंफ्यूजन आई है 2-3 मुख्तलिफ वीडियोस को देख के आप स्टूडेंट्स में कि दैट either it is an irregular bone, flat bone, or irregular and flat bone. So if we are talking about hip bone incomplete, that is comprising of ilium, ischium and pubis, that is an irregular bone. But if we are considering only the ilium portion, then that is irregular in aspect of its margins and flat in aspect of the surface. So that is a confusion if we are looking at a specific area that can be flat, otherwise rest of the bone is irregular. Okay, so the 3 subcomponent bones of hip bone is ilium, ischium and pubis. What is the difference between ilium and ilium? I-L-I-U-M or I-L-E-U-M?
Sir, ilium is the part of small intestine.
It's the part of small intestine.
I-L-E-U-M is the part of small intestine, ilium, and ilium, I-L-I-U-M is the part of hip bone, and ilium, I-L-E-U-M is a part of the small intestine. So make it remember that, because it makes confusion among the two terms. Okay, so when we are talking about the hip bone, that is an irregular bone comprising of, found by the union of 3 bones, ilium, ischium and pubis. The junction point is the central area, that is the acetabulum. For descriptive purposes, that is divided into 5 segments of 5 portions. 2/5 of the acetabulum is formed by ilium, 2/5 is formed by ischium, and only the 1/5, the smaller portion, that will be formed by the pubis. So that is the contribution in the formation of acetabulum, and acetabulum is that concave area that fits in the, yes.
सर काफी बच्चों की मीटिंग ओपन नहीं हो रही सर।
उनको अब ये कहो कि जी रजिस्टर करके अपने ईमेल अकाउंट देखें, वहां पे ईमेल गई हुई है।
ओके सर।
And I'll be waiting for 1 or 2 minutes more so that others can join. Meanwhile, if anyone of you has any query, ask me.
सर
जी
सर, बेसमेंट मेम्ब्रेन और बेसमेंट लेमिना में क्या डिफरेंस होता है?
Is it lamina or basement membrane? अच्छा जी, लेमिना किसको कहते हैं? Wordly meaning of lamina is a layer And basement membrane is a composition or compiled structure that is the basal lamina is a portion of it. Okay, so when you study from the Janquera, that gives a clear description of basement membrane and the components of the basement membrane and what is a basal lamina. अहमद हसन, अगर आप वाक्यों से कंफर्म कर दें कि उनका प्रॉब्लम सॉल्व हुआ है या नहीं.
सर वो इशू आ रहा है कि सर्वर नॉट फाउंड, ये वाला इशू आ रहा है सर.
जिन स्टूडेंट्स को इस तरह प्रॉब्लम आ रही है उनके ईमेल एड्रेस आप मुझे दे दो, इनविटेशन मैं उनको दोबारा भेज देता हूँ.
ओके सर.
ठीक है जी. सो अगर वी आर टॉकिंग अबाउट द इलियम, सो दैट इज an irregular bone having two margins, upper margin and the lower margin. The upper margin is the iliac crest and the lower margin that merges or fuses in the acetabulum, that is a narrow portion. If we talk about the borders, so there are three borders of hip bone, of ilium specifically. Anterior border, starting from first we talk about the iliac crest. That is the upper thick margin or thick border of this bone, and that is present in the form of an S. And that means it in the interior part it is concave forward or convex forward, outwards.
Concave.
In the interior portion that is concave outward, and in the posterior part it is convex outward. Concavity is different in both the portions. That is concave outwards in the interior portion and convex outward in the interior portion and concave outwards in the posterior portion. Just let me send the invitation to the rest of the students. अच्छा जी. उसके बाद इंटीरियर जो iliac crest की अगर हम बात करते हैं तो उसमें anterior margin is anterior superior iliac spine. Posteriorly it is posterior superior iliac spine. ठीक है जी. अगर and if we are talking about the interior border या interior border, तो उसमें क्या कुछ होगा? That begins from the anterior superior iliac spine and lower down it ends up in the acetabulum. and this upper margin of the acetabulum is the anterior inferior iliac spine. G. Moving back. ठीक है जी, so anterior border starts from the anterior superior iliac spine till the acetabulum, and then in its lower margin there's the anterior inferior iliac spine. Similarly, when we talk about the posterior border, that starts from the posterior superior iliac spine, moving downwards till the area where the ischium starts. The prominence in the posterior border is the posterior inferior iliac spine, and this concavity is or notch is the larger in size, and this is called the greater Ciatic notch. So the what is the difference between the notch and the foramen?
Foramen is enclosed on all sides.
Foramen is a closed area bounded all around, whereas notch has the three boundaries.
सर स्टिल वही इशू आ रहा है, साइट कांट बी रीच्ड।
अच्छा, ये कहें कि ब्राउजर चेंज करके देख लें।
ओके सर।
ओके जी। अच्छा, इंटीरियर बॉर्डर हमने देख लिया, स्टार्टिंग फ्रॉम द इंटीरियर सुपीरियर iliac spine till the acetabulum. posterior border की हमने बात की, posterior superior iliac spine से लेके upper lower margin of the greater Ciatic notch तक जाएगा, where it becomes continuous with the ischium. ठीक है जी, इनके दरमियान में posterior inferior iliac spine आ जाएगा और anterior inferior iliac spine आ जाएगा. When we talk about the medial border, anyone having the idea about the medial border? What is the medial border of ilium? From where does it start and which surfaces are present in this area? Anyone? what is the medial border of ilium, and which surfaces are present on the medial aspect of ilium? D roll number 155. Anyone else? So what is the medial border of hip bone? Okay, it starts from the upper margin of the iliac crest, about 5 centimeter anterior to the posterior sciatic spine, moving downwards up till it merges with the pubis bone or pubic crest. So this divides the medial aspect of the ilium bone into two areas. The upper depressed area is the iliac fossa that gives origin to the iliacus muscle, where you have heard the name iliacus. Where the name femoral triangle floor mein. Okay, so we will be seeing it originates from the iliac fossa and is inserted in the after passing through the floor of femoral triangle. Okay, so this medial border divides it into upper part the iliac fossa and lower part is this rough area is the iliac tuberosity, and anterior to it is this ear-shaped area is the sacropelvic surface or the auricular part. ठीक है, auricular surface of the this complete would be the sacropelvic surface. इसको sacropelvis इसलिए कह रहे हैं कि it is directed towards the pelvic cavity and the sacrum. So the sacropelvic surface is divided by the medial border into the iliac fossa anteriorly or superiorly, and inferiorly there are two parts. The posterior rough area is the iliac tuberosity, and the lower down in the form of an ear-shaped area is the auricular surface. This is concave, and this is the articular surface to articulate with sacrum to form the sacroiliac joint. This iliac tuberosity is non-articular. ठीक है, so आपने जो sacropelvic surface है that was divided by the medial border. Into the upper part the iliac fossa and lower part there are two subdivisions. The rough area is the iliac tuberosity, which is non-articular, and interiorly this ear-shaped area is the auricular part of sacropelvic surface, and it will articulate with the sacrum to form the sacroiliac joint. Then this medial border further continues down and continues as the arcuate line. Okay, what is an arcuate line? Memona Gulzar. Memona Gulzar, can you hear me?
Yes, sir.
Okay, so can you tell me the various parts of the ilium bone?
Sorry, sir.
Sure. What is anterior superior iliac spine? Arcuate line is the one that is in some part that is the portion of medial border of ilium, and it divides the false pelvis through the true pelvis area. And what is the difference between the false pelvis and true pelvis? Okay. So arcuate line is this portion that connects with the pubis bone, and completely this margin that would be dividing the upper wider portion, the false pelvis, through the from the true pelvis, that will be called the pelvic brim. And arcuate line is in the form of an arc. This one. So the arcuate line, sacral promontory, and arcuate line of the other side completely form a brim or a margin that separates the false pelvis cavity, the upper one which is connected to the abdomen, from the lower true pelvic cavity. Okay, so that is the demarcating point, and arcuate line is its anatomical landmark which separates the false pelvis from the true pelvis. Then we talked about the greater and lesser sciatic foramens. What are the greater and lesser sciatic notches and greater and lesser sciatic foramens? This larger one is the greater sciatic notch, and that is completed by a sacrospinous ligament connecting from the sacrum to the ischial spine. And this foramen will be the greater sciatic foramen. In the next stage, we will be studying the structures which are passing or exiting through the greater sciatic foramen to enter the gluteal region or the back of thigh. Then the lesser sciatic notch was a depression in the ischium, and that is bounded or changed into foramen, lesser sciatic foramen, with the help of sacrotuberous ligament, starting from the sacrum to the ischial tuberosity. So these two foramens are formed with the help of these two ligaments. The notches gets converted into foramens, greater sciatic foramen and lesser sciatic foramen. Then you must have an idea about two terms, the mid-inguinal point and midpoint of inguinal ligament. Can anyone describe the difference between the two? What is mid-inguinal point and midpoint of inguinal ligament? The inguinal ligament is attached to the pubic tubercle and starting from the anterior superior iliac spine. Okay. So when we take its midpoint between the anterior superior iliac spine and the pubic tubercle, that will be called the mid-inguinal point.
सर जिन बच्चों को ज्वाइन नहीं हो रहा फिर अटेंडेंस कैसे लगी इनका इशू आ रहा है सर्वर का
उनके नाम आप मुझे मैसेज कर देना उसका मैं देख लूंगा
ओके सर
अच्छा जी एक मिनट let me check the link again. अच्छा जी मिड inguinal point और mid point of inguinal ligament इनका डिफरेंस anyone
Mid-inguinal point is the midpoint of an imaginary line that joins the superior iliac spine with the pubic symphysis.
okay and mid-inguinal point midpoint of inguinal ligament
It is the midpoint of a ligament that joins the two.
the anterior superior iliac spine to the pubic tubercle. When we take the midpoint, that is midpoint of inguinal ligament, and from anterior line drawn from the anterior superior iliac spine to the pubic symphysis, and this center point taken, that would be mid-inguinal point. So mid-inguinal point is more medial as compared to the midpoint of inguinal ligament. And these landmarks are important regarding the location of the femoral artery and the differentiation of the femoral hernia from other clinical conditions. Okay. Now, moving on to the femoral triangle. What is femoral triangle? So first we talk about the great stephanus vein. That is one of the superficial veins of the lower limb. What you have studied about the great stephanus vein? That is one of the superficial vein, and as compared to the upper limb, that is the one cephalic and basilic vein was the one that were present in the upper limb, and the great and the small stephanus veins will be found in the lower limb. The great stephanus vein starts from the medial margin of the dorsal venous arch, moving or ascending medially along the leg. In the region of knee joint, it moves posteriorly towards the popliteal fossa, and again it turns back to the medial surface of the thigh. In the upper 1/3, it becomes anterior and moves down deep into the deep fascia or the deeper vein, that is the femoral vein, passing through which opening? It passes through which opening to reach the femoral vein?
Obturator foramen.
No. Stephanus opening. And where does this stephanus opening is found? This is an opening in the deep fascia of the thigh that is called the fascia lata, about 2 inches below and lateral to the pubic symphysis. And passing through the cribriform fascia, the great stephanus vein drains into the femoral vein. Early crest की the clinical importance you read, that was one of that was it helps in the taking of biopsy for the blood cells, bone marrow biopsy, because it is a spongy bone in the iliac crest, and that can help to identify or diagnose the clinical conditions. Regarding the fractures of the hip bone, that can be categorized into three, occurring by the lateral compression or the side to side. It can be from anterior to posterior as in road traffic accidents, and can be the vertical breakage of the bone due to the fall on one side or an extensive force that can be applied. What could be the results if there is a lateral compression? Would there be damage to the pelvic viscera?
Yes, sir.
Okay. In the anterior posterior, that is the part of the pubis bone and the ischium can get broken, and that can again damage to the nerves passing behind. And in vertical damage, the portion of the bone is displaced, and the structures present in that specific area would be affected. The other side will remain intact. Avulsion. What is an avulsion? When there is an excessive extension, the tendon attached to the bone tears or breaks. It can be the tearing of the tendon, or some part of the bone can be displaced along with the or broken along with the muscle tendon, and that is the avulsion fracture. If there is excessive hamstring muscles are the posterior ones that causes the extension. If there is excessive extension, it would cause the hamstring injuries. If iliopsoas normally the iliopsoas cause flexion. Normally, the iliopsoas causes the flexion of thigh at the hip joint. If that is excessively extended, that can lead to the injury again. Okay. What you can see in this diagram? What is visible in this diagram? I want to emphasize one thing, that maximum the answer can be wrong, but you must have the courage or learn or practice to answer the questions. That is the main problem which you face during the vivas and the university examinations, that you have not the practice to answer. I would not mind the wrong answer, but if you don't respond, it means either you are not available or not interested.
Edema or swelling in the vein or lymph vessel?
Edema or swelling in the vein, how can that be possible? That is a tortuous appearance of the great stephanus vein. You can identify the big toe, so it is starting from the medial side, extending upwards. So this is the tortuous or excessively engorged vein, that is the great stephanus vein, and this clinical condition is called the varicose vein. Okay, so when you compare these two, on the left side, that is a normal condition in which the blood is flowing back normally and is guarded by the wells. But if these wells become incompetent, which are connecting this superficial and deep veins, then the blood would get turbulence. There will be regurgitation or backflow of the blood and pooling as well, because the venous blood is pushed back with the help of these valves. When the valves become incompetent, the blood cannot move against gravity and will pool up and become stagnant, leading to the dilated tortuous veins. And these dilated tortuous veins are called the varicose veins. There are 4 or 5 levels communication between the deep and the superficial veins of the lower limb. So if a patient comes to you with this condition, it has to be identified the level at which the valves are not functioning properly. And to check this clinical examination is called the Trendelenburg's test, in which the patient is made to lie on the flat surface. The leg is raised so that all the venous blood is drained back into the deep veins, and the tourniquet or the bands are applied in the 3 or 4 regions, one in the middle of the thigh, 2 or 3 in the leg region. And the patient is again made to stand up. If the incompetence of valve is above the level of the ligature, the swelling will occur. But if we open these ligatures one by one, so we can check the level at which the valves are not functioning properly, and the veins would become enlarged or filled with the blood. So this is the Trendelenburg's test. While you will be studying from your books, and other clinical condition will be again given the name of Trendelenburg's test, that is for checking the gluteus medius and minimus, and you see the nerves, that is the inferior gluteal nerve. We will be studying later on, but remember, the Trendelenburg is the term used for 2 clinical conditions, one for the varicose veins and one is for the injury of the inferior gluteal nerve, paralyzing the gluteus medius and minimus. This is the oval opening we call the stephanus opening, that is 2 inches below and lateral to the pubic symphysis. This thick fascia that is shown in yellow is the fascia lata. That is a modification of deep fascia of the thigh, starting above from the inguinal ligament, pubic tubercle. Laterally, it is attached to the iliac crest and posteriorly to the sacrum. And below, this merges with the tibial condyles. On the lateral aspect, there is a thickening or modification of fascia lata, that is the iliotibial tract, starting from the iliac crest, and lower down it is attached to the lateral condyle of the tibia. Again, iliotibial tract is taken because it is attached superiorly to the ilium and below to the tibia. 2 muscles are inserted in it. From anterior aspect, the tensor fascia lata, and on the posterior aspect, the gluteus maximus. These 2 muscles are inserted in the iliotibial tract. Some fibers of gluteus maximus will also be inserted to the femur, so there has the double insertion. Okay. Now, anyone can tell me what you have studied regarding the femoral triangle? What is a femoral triangle?
Depression on the anterior part of a thigh.
Shape is? That is triangular. Okay. Abdul Rahman, rule number 2. Are you there? Abdullah Nawaz. Roll number 216. Those who are not answering will be marked absent. I have made you clear that I am not concerned with that either the answer is right or wrong, but you should respond. Okay. Femoral triangle is a triangular depressed area in front of the thigh that is bounded. It has, when we talk about the boundary, it would be having the lateral boundary, medial boundary, superiorly margin, floor, and the roof. So when we talk about these margins, so laterally that is formed by the medial border of sartorius. This is formed laterally by the medial margin of sartorius. Let me change the color. Medial margin of sartorius. On the medial side, that is formed by the adductor longus. Adductor longus would be present in the floor as well as the medial boundary, so it has two components. And superiorly, the inguinal ligament. These are the three boundaries that are in the horizontal plane. Laterally by the medial border of sartorius, medially by the medial margin or the lateral margin of adductor longus, and superiorly by the inguinal ligament. In the roof, there would be skin, superficial and deep fascia, that is the fascia lata. The great stephanus vein would be running in the superficial part. So these will be present in the roof. The floor is formed by certain muscles starting from the lateral to the medial side. That would be iliacus, psoas major, iliacus muscle. Then would be the psoas major muscle. These two have the collective insertion or the same point insertion, so they are collectively called as the iliopsoas muscle. Then is the pectineus, starting from the pectineal line of the pubis and is inserted to the femur, and the medialmost would be again the adductor longus. So these four muscles make the floor of the femoral triangle. Medial boundary by adductor longus, lateral boundary by sartorius, and superiorly by the inguinal ligament. The roof is formed by the skin, superficial and deep fascia, along with the great stephanus vein. Now, when we are talking about the contents of this triangular area, that would be the femoral artery, femoral vein, femoral nerve, and on the medial side, there would be a lymphatic channel or the lymphatic canal, they call the femoral canal. And the branches and tributaries of these veins as well. Clear so far? Have anyone of you read the femoral sheath? What it is?
जो शीट फीमर को इनक्लोज करेगी, फीमर बोन को।
फेमरल नर्व नहीं होती इसमें, फेमरल आर्टरी होती है और फेमरल वेन होती है।
What is the femoral sheath? What is the femoral sheath?
हमने इतना ही बताया था, शीथ इनक्लोजिंग फेमरल आर्टरी एंड फेमरल वेन।
Okay. Anyone else?
It's the continuation of abdominal fascia. And it includes only femoral artery and femoral vein.
Okay. अच्छा जी. So अच्छा जी, यहाँ पे आपने देखना अच्छा है कि एब्डोमेन में हमने दो मसल्स का जिक्र करेंगे। एक है इलियकस मसल जिसकी हमने बात की, दैट ओरिजिनेट्स फ्रॉम द इलियक फॉसा। एक ट्रांसवर्सस एब्डोमिनस मसल आएगा. So the epinosis covering these two muscle will extend down into the thigh region, okay, about 2.5 centimeter below the inguinal ligament. That is called the femoral sheath. That is formed by anteriorly by fascia transversalis and posteriorly by the fascia iliaca. That is the fascia of iliacus muscle. Okay, so these two extend vertically downward, fascia iliaca and fascia transversalis, to cover these femoral artery, vein, and medially the area or the space left for the lymphatic is the femoral canal. The margin of the femoral canal is slightly thickened by the surrounding ligaments. That is called the upper margin of the femoral canal or the femoral ring. Okay. Near the termination of the femoral sheath, there is a rounded opening in the fascia lata that is called the stephanus opening, that is filled up with a sieve-like or the porous fat that is called the cribriform fascia. The great stephanus vein passes this fascia to enter the or drain into the femoral vein. The other tributaries of femoral vein will pass deep through the cribriform fascia, and the branches of femoral artery will exit through the cribriform fascia. But the point to remember is that the femoral nerve is not the content of the femoral sheath. The three compartments of the femoral sheath are: lateralmost is the femoral artery, intermediate area contains the femoral vein, and the medialmost is for the lymphatics, the femoral canal. So, what would be the importance or the clinical use of the femoral canal empty area or the empty channel? It provides a potential space or the area that allows the dilation of the femoral vein or the femoral artery when required. When the blood is passed in the femoral artery under high pressure, or the blood is in strenuous exercises, the blood venous return is more. So these vessels can dilate and accommodate in the femoral canal region. Now the next question is, why the femoral nerve is not the content of the femoral sheath? Anyone having some idea? It would not be known to you as yet, so there is no problem in not correct answer.
कि अगर
If you say-
फेमरल शीथ को कोई इंजरी होती है या कोई प्रॉब्लम होती है तो हमारी नर्व तो डैमेज ना हो, उसने फेमरल कंपार्टमेंट को जाके इनर्वेट करना है सारी मसल्स को.
Okay. It can be, but it is not the exact mechanism due to which this is so. Okay. So, there are two reasons that describe the fact that the femoral nerve is not enclosed in the femoral sheath. Point one is that the femoral nerve originates from the abdominal region in the lateral margin of psoas major, and in the body no nerve is covered by the fascia. You have read the brachial plexus, and none of the branches were covered by the fascia. So similarly, there will be no nerve in the lower limb as well that would be covered with the fascia. And secondly, the point of origin of the two structures is different. Fascia iliaca and fascia transversalis are the vertical downward extensions of the fascia in the midline near the pubic symphysis, right? Whereas when we see the femoral nerve, just a minute, this is the lumbar plexus originating in the abdominal region. The femoral nerve exits along the lateral margin of the psoas major and descends down. If we see the location of the femoral vessels that are present in this area, that was a direct downward extension fascia iliaca and fascia transversalis. Okay. So the point of origin of the two structures is different. Fascia iliaca and fascia transversalis are the direct downward continuation, whereas the femoral nerve exits along the lateral margin of the psoas major and then enters into the femoral triangle. And secondly, there is no nerve in the abdominal region that is covered with the fascia, so the same rule would apply over here. Actually. Can anyone in the region of the femoral triangle, can anyone tell me the name of the branches that originate from the femoral artery?
Right and left common iliac artery.
That are in the abdominal pelvic region, okay? Right and left common iliac that divide into the external and internal iliac. The external iliac continues behind the inguinal ligament as the femoral artery, okay? So in this region, what is the extent of the femoral artery? It begins from it is the continuation of external iliac artery behind the inguinal ligament, ठीक है? और इसके deeper down ये distal extent कहाँ पर होगी? When it passes through the opening in adductor magnus to become the popliteal artery. ठीक है? So in the femoral triangle region, it will give total 6 branches. 3 will be superficial and 3 are deep. In the superficial, there are superficial epigastric to the lower central part of the abdominal wall, superficial external pudendal that would be going to the external genitalia, and superficial external iliac that would be going laterally to the iliac crest region. The 3D branches are the muscular branch to the muscles of this area, then is the profunda femoris, similar to that of profunda brachii in the upper limb, correct? And the deep external pudendal that would be again going to the genital organs. Superficial external pudendal supplies the skin over the external genitalia, whereas the deep external pudendal will supply the genital organs. Clear so far? And similarly, the same veins that would be accompanying these arteries would return back and drain into the femoral vein. Clear? Now, quickly going through the muscles in the anterior compartment of thigh, which are total 4 in number or 5 in number. The superficial most is the sartorius, that is the strap muscles originating from the anterior superior spine, moving downwards and medially, and is inserted to the medial condyle of tibia. Sartorius. Then there are 4 muscles remaining in the central midline, rectus femoris, and below it there are the 3 vasti. On the lateral side, vastus lateralis. In the center, vastus intermedius, and on the medial side, there would be vastus medialis. So collectively, the tendon of these 4 muscles is inserted to the upper margin of the patella. The tendon of quadriceps femoris, okay, and along the lower margin of the patella, the ligament will be ligamentum patelli. We will be studying it later on. So the 4 muscles, which are the rectus femoris and the 3 vasti, they are collectively called as the quadriceps femoris, and you must not confuse or mix the name with the quadratus femoris that would be present on the posterior aspect of the thigh in the gluteal region. quadratus. Quad is for 4. Quadriceps, 4 muscles. And quadratus femoris would be the one that is having the 4 boundaries or the square muscle. Can anyone tell me the square muscle of the upper limb?
Pronator quadratus.
Pronator quadratus. That was correct. Okay. So this is the diagrammatic representation of the femoral sheath, that is a conical portion tapering lower down. Femoral canal has the deep inguinal lymph nodes, which are called the lymph nodes of Cloquet or Rosenmuller. In MCQ, you can be asked the name the lymph nodes which are present in the femoral canal. So the correct answer would be the lymph nodes of Cloquet or lymph nodes of Rosenmuller. Regarding the lymphatics of the last thing I am discussing, so that you can continue with the next lecture, that the inguinal lymph nodes are present in the form of a T-shaped horizontal group and the vertical group. The horizontal group would be receiving the lymphatics from the superficial part, lower abdomen and upper thigh, and the vertical area would be receiving the deep lymphatics from the lower limb. Any question? Okay. Allah Hafiz, and now you can join with the next lecture. That is of physiology, I think. Biochemistry, I think. Allah Hafiz.
Thank you, sir.
Allah Hafiz, sir.